The deltoid ligament is the medial collateral ligament of the ankle joint. It's just inferior to the medial malleolus, and it is broad and strong, and it's not easy to palpate, only on superficial healthy ankles. Grasp the forefoot or calcaneus with one hand and place the finger over the deltoid ligament right under the medial malleolus. Then we're going to have our patient evert the foot and press down, so you should feel a little springy structure. This is a deltoid ligament. Tibialis posterior tendon. It's going to be from the medial malleolus, and we're going to palpate the soft tissue depression between its posterior aspect of the Achilles tendon. The structure is the most anterior and must have the patient invert and plantar flex their foot to palpate. The flexor digitorum longus tendon is just behind the tibialis posterior tendon and slightly above the malleolus. We're going to have our patients flex their toes, and then we're going to be able to palpate the structure. The flexor hallucis longus tendon cannot be palpated unless symptomatic. It runs along the posterior aspect of the tibia and grooves the posterior aspect of the talus. It would be indicated by this black line we have here. The posterior tibial artery is between the tendons of the flexor digitorum longus and the hallucis longus. The foot should be relaxed and non-weight bearing, and it's going to be indicated by this green line. And to palpate it, we're going to use our two fingers. Tibial nerve is posterior and lateral to the posterior tibial artery. It's difficult to palpate unless symptomatic. It's going to be indicated by this orange line. So the tibialis anterior tendon is the most prominent, most medial of the three tendons. We're going to have our patient dorsiflex and invert the foot against resistance, and then palpate the distally to its insertion on the medial aspect of the base of the first metatarsal and first cuneiform bones. The muscle belly is on the lateral side of the tibialis shaft. So immediately lateral to the tibialis anterior tendon, we're going to have our patient actively extend the great toe and palpate along its dorsum of the foot to its insertion into the base of the distal phalanx of the big toe. The extensor digitorum longus tendon. It lies laterally to the extensor hallucis longus, so we're going to palpate it when it crosses the ankle. And then we're going to have the patient extend their toes and then palpate the tendon that's split into the four parts of the distal phalanx on each of the toes.